Hi guys, good morning. So the new discussions. So we're going to start with conjunctiva discussion. Are you ready? So yesterday we started a new cycle of tests. So the conjunctiva quiz. Good morning. Who is this? Good morning. Good morning. All right. So shall we start with the question discussion? All of the following symptoms are possible in a case of pterygium except. Good morning, bache. Good morning. Good morning, Gokul. Happy morning. All happy. Who is this? Gina. Gina, sir. All right. All right. So pterygium, dryness of eyes. Yes, there is dryness of eyes in pterygium because of the uneven distribution of the tears. See, for the tear to spread on your ocular surface, the surface first of all has to be even. So when you have an uneven surface because of the pterygium, definitely the distribution of tears would be difficult. Yeah, so you will have dry eyes. So that is not the answer. Oh, UK, you changed your name. All right, Umesh. All right. Diplopia. Yes, diplopia can happen because of the fibrotic component of pterygium. See, what is the definition of pterygium? It's a fibrovascular proliferation. Fibrovascular proliferation of the conjunctiva and the subconjunctival tissues. Okay. So, because the fibrous component, you can have diplopia, restriction of ocular motility. So there can be double vision. What is diplopia? Double vision. So it is possible. Redness. See, occasionally pterygium can get inflamed, and also when it is very vascular, it appears red and it can get inflamed. So in that case, you can get redness. Photophobia. What is photophobia? So there is a discomfort on looking at light. So anytime light is shown on the eye, there is a discomfort, not really pain, but yes, there is a discomfort. So that is described as photophobia. Photophobia, there's no reason for pterygium to cause photophobia at all. See, even when it invades into the cornea, it only destroys the cornea, doesn't cause inflammation of the cornea. Okay, so there is no photophobia in pterygium whatever. All right. Okay, so shall we move to the next question, guys? Maximum density of goblet cells are found in option A, limbus, option B, superotemporal bulbar conjunctiva, option C, superotemporal, inferotemporal bulbar, inferonasal bulbar, palpebral conjunctiva. Okay, so here goblet cells are maximum found. Okay, so it's not in the option, it's inferior fornix. Okay, maximum is inferior fornix, right? That's not even there in the option. Next is palpebral conjunctiva. Okay, next is palpebral conjunctiva, and then comes your inferonasal bulbar conjunctiva. Okay, so that is the latest. So inferior fornix is where your goblet cells are maximum density, followed by palpebral conjunctiva. Then you have inferonasal quadrant of bulbar conjunctiva. Is that clear? So goblet cells, what is the role of goblet cells? Goblet cells produce the innermost layer of tears. Okay, so the innermost layer of tears is your mucin. So goblet cells, where are they maximally present? They are present in the inferior fornix. That option is not there in this question, but the next best is palpebral conjunctiva. So the answer is palpebral conjunctiva. Third is inferonasal bulbar conjunctiva. So if those two are not there, then you can go for inferonasal bulbar conjunctiva. Is that clear? Okay. Next question. Chemosis may occur in all except. Please tell me, what is chemosis? What is chemosis, guys? What is chemosis? Chemosis. Come on, what is chemosis? What is chemosis? Yes, edema of conjunctiva. Very good, Gokul. Edema of conjunctiva is chemosis. So the balloon, so what happens when there's edema of conjunctiva? There's ballooning of conjunctiva. Yes, when will you have edema? See, edema you can have when you have very severe inflammations, very severe allergies, or for some reason the interstitial pressure is increased. Yes, that is because the venous pressure is increased, so fluid is oozing into the extracellular space, into the interstitium. So when will the venous pressure get increased? When the venous blood is not going out into the cavernous sinus. Yes, so let's see. Option A, thyroid eye disease. Say thyroid eye disease is like a compartment like syndrome, orbital compartment like syndrome is there. So again, the venous outflow is blocked because there's so much of pressure in the orbit. So what happens, especially at the apex, so it oozes, the fluid oozes into the conjunctiva. So you get chemosis. Yes, it is there. Cavernous sinus thrombosis. See, the cavernous sinus itself is thrombosed. The venous blood is clotted. So fresh venous blood cannot get into it, right? So it stays in the orbit, it stays in the veins of the orbit, and the conjunctiva oozes into the interstitial tissue. So yes, do I get chemosis in cavernous sinus thrombosis? Yes, I do. Chemical conjunctivitis. See, chemical conjunctivitis is some irritation. It's a severe inflammation. It's an inflammatory conjunctivitis, non-infective conjunctivitis, typically which occurs in a neonate on the day of birth. Yes, so there it is characterized by redness and chemosis. In the newborn, day 1, okay, day 0 of birth, there is no discharge. There is only chemosis and redness. Yes, so it is there. What's the last option? Angular conjunctivitis. Angular conjunctivitis is not that severe in inflammation. All that you get is redness at the canthi. Yes, and some excoriation at the lid margins. And what is angular conjunctivitis due to? So our answer is there is no chemosis in angular conjunctivitis. So that is the answer. So what is the organism causing angular conjunctivitis? Very, very important, especially the FMG exam is coming up. FMG exam, this is very, very important question. What is the organism causing angular conjunctivitis? So I'm about to say the organism itself. So what is the organism causing angular conjunctivitis? Okay. Next question. Subconjunctival cicatrization is typically seen in. What is a cicatrization? Cicatrization means there is scarring. Subconjunctival scarring is seen in trachoma, vernal keratoconjunctivitis, flictinular conjunctivitis, giant papillary conjunctivitis. Okay, let me rephrase the question. Art's line is seen in. Art's line is seen in. What is the answer? Art's line, where do you see Art's line? What is Art's line? When you flip the conjunctiva, the upper lid, when you flip the lid, you see a white horizontal scarred line on the upper palpebral conjunctiva. That is Art's line. Now, in which condition do you get Art's line? Yes, which condition do you get Art's line, guys? Again, an important question for FMG. Art's line is seen in. Art's line is seen in. Yes, Art's line is seen in trachoma. Yes, so that is a subconjunctival scarring that we are talking about. So subconjunctival cicatrization is typically seen in. So subconjunctival cicatrization is nothing but the Art's line that we are talking about. It is seen in trachoma. Okay. Now next question, histology of papillae of spring catarrh. So when you look at the papillae, when you take a histological section and look under microscope after staining, what would you see? You will see a central vascular core, okay, and epithelial hyperplasia. So you will have epithelial hyperplasia, making it, raised like this, like tabletop, and in the center of that you will have a vascular core. Okay, so there is a plateau, you'll see this tabletop of epithelial hyperplasia, and in the center of which you will see vascular core. So let's see if there's some option like that. Subepithelial lymphoid germinal center. No, that would be follicles. Lymphoid germinal center means follicles, because follicles are lymphoid hyperplasia of the conjunctiva. Hyperplastic conjunctival epithelium with a fibrovascular core. We got our answer. So that is option B. Option C. Inflamed conjunctival epithelium with adherent coagulated exudates. That describes a pseudomembrane. Pseudomembrane, you have a fibrous exudate which is on the surface of the epithelium. Yes, so that is pseudomembrane. What about option D? Fibrous cicatricial bands in the stroma. That describes our Arl's line. The cicatricial bands in the stroma is the Arl's line. So, what do you see if you were to look at the histological picture of papillae? You will see epithelial hyperplasia with a fibrovascular center. Okay. Topical steroids may be used in vernal keratoconjunctivitis. Yes, but don't hurry. Look at the other option. Flictinular keratoconjunctivitis. Yes. Membranous conjunctivitis. Yes. So option D, all of the above. See, vernal keratoconjunctivitis, steroids is not the first choice. But yes, I can use it. Yes. So it's used in vernal keratoconjunctivitis, flictinular keratoconjunctivitis, membranous conjunctivitis. So all of the above. Next question, adult inclusive conjunctivitis is caused by, this is a one-liner. Again, it's very, very important for FMG. So this organism, Chlamydia trachomatis D to K. It causes both adult inclusion conjunctivitis and it also causes neonatal conjunctivitis. Okay, so for FMG exam, note it down. It's very, very extremely important. So adult inclusion conjunctivitis is caused by Chlamydia trachomatis serotypes D to K and it also causes neonatal conjunctivitis. And what about trachoma? Trachoma, serotype is different. Yes, Chlamydia trachomatis, but serotypes A, B and C. Okay, A, B. In fact, we say BA, there's a capital B, a small a and C. Okay, so that is for trachoma. Trachoma involves what type of hypersensitivity? See, trachoma involves type 4 hypersensitivity. Please remember, trachoma involves type 4 hypersensitivity. Yeah, that means delayed type hypersensitivity, cell-mediated immunity, right? Okay, next one. Conjunctival scrapings are obtained from a baby diagnosed of neonatal conjunctivitis. We don't usually do that, but yes, they've done it. Now, on GNSA staining of the scrapings on a glass slide, multinucleated cells are seen. What is the most likely etiology? So, basically, we are doing a Sang smear. So, what do you see on Sang smear? And for what you do Sang smear? Sang smear, if you're seeing multinucleated giant cells, that means there is a virus involved. Gonococcus option A, no. Staphylococcus, no. You will see Staphylococcus means you will see clusters of round cells. Gonococcus, totally different morphology. Chlamydia, HSV, herpes simplex virus. Yes, HSV type 2 can cause neonatal conjunctivitis in the second half of first week and the first and second week. Okay, so it's not in the first 3-4 days. It's in the second half of first week and the second week viral conjunctivitis. Okay, so neonatal conjunctivitis can be caused by virus. Which virus? HSV type 2. Yes, adult viral conjunctivitis is usually adenovirus. Okay, what is the most common cause of viral conjunctivitis in adults? Adenovirus. Neonatal conjunctivitis, it is your HSV type 2. What about keratitis, guys? What is the most common cause of viral keratitis? Right, the most severe adenoviral ocular infection. Option A, pharyngoconjunctival fever. Yes, caused by adenovirus, but it is not the most severe. Then, option B, epidemic keratoconjunctivitis, EKC. Option C, acute hemorrhagic conjunctivitis, again caused by adeno. B also caused by adeno. Molluscum contagiosum, at least not adenovirus, so that is ruled out. Now, among the three, all of them are caused by adenovirus, different serotypes. But what is the most severe? I told you that epidemic keratoconjunctivitis, because it infiltrates the cornea. Yes, and it causes a lot of vision issues also, vision problems. So that is the most severe. See, all the others, acute hemorrhagic conjunctivitis, yes, the eye will look very scary, red, bloody red, blood red. But only conjunctivitis, it is not keratoconjunctivitis. Okay. Similarly, see, pharyngoconjunctival fever, there is a sore throat, there is fever, there is conjunctivitis. Cornea is not involved. So the question is very clear. It says the most severe adenoviral ocular infection. Yes, severe. So it is epidemic keratoconjunctivitis. And how is epidemic keratoconjunctivitis caused? So EKC is caused by adenovirus serotypes 8, 19 and 37. Right? What causes EKC? 8, 19, 37. Pharyngoconjunctival fever 3, 4, 7. So PCF. Okay, 3 letters are there. Pharyngoconjunctival fever 3, 4, 3 plus 4, 7. Right? Now, acute hemorrhagic conjunctivitis adenovirus 11. Okay, acute hemorrhagic conjunctivitis adenovirus 11. The most severe, again, please put it in your brain box, is epidemic keratoconjunctivitis EKC caused by adenovirus serotypes 8, 1937. 8, 1937. All right. Okay, so this evening we've got cornea quiz at 6 p.m. and tomorrow 11 we'll have the discussion of the cornea quiz. And in the meantime, there are MCQs. So let's do ophthal MCQ. I've put up questions for you. So please look up on Instagram or on YouTube and please answer. And if you want to join the test and discussion, yes, you can ping me on the link that I have given in the video description. And also the New Year sale is on. There's one more day, today and tomorrow. Yeah, today and tomorrow the New Year discount will be on. It's applicable on all the books, and also there is a special discount for the university exams. There's a 1 month course validity. So I think they price it very reasonably. I told them just give a so that students can watch the videos. So you can finish ophthalmology in 30 hours. Okay, for your theory exam, just 30 hours, your essays and short notes all covered CBME pattern. So it'll be very useful for your theory exams. So, so that is a course. If you want to know what the course is about, you can DM me on my WhatsApp number, which is 9363435048, or you can DM on the app. The staff will reply to you. So ask that you want to, you're preparing for the final prof exams, and they will give you the link for the appropriate course. There's a 1 month validity, which will be very useful for those of you going for exams because your dates are announced. Okay, so tomorrow 11, I will see you guys. Bye. Have a good day, all of you.